In this video, I'm going to be talking about complete open bite closure corrected with Invisalign in 12 months. This is different than anterior open bite, which is in the front, or lateral open bite, which is on the side. This is complete open bite, which is both sides of all teeth. So let's go. Hey guys, this is Dr. Robert Passamano. I'm a board certified orthodontist. Today we're going to be talking about complete open bite closure fixed with Invisalign in 12 months. As you can see in the photos, we have an open bite on the right, we have an open bite in the center, and we have an open bite on the left. This is called complete open bite, where it's pretty much everywhere. On the bottom photos, you can see that the open bite is closed. We have nice contact for the posterior teeth. This is closure. This is an excellent case where we're able to get everything closed and complete the goals of the orthodontic treatment. So let's dive a little deeper into this patient's initial positions of teeth. You can see we have a little bit narrow of a upper arch. You can see a little constriction in the top premolar area. This resulted in a 2 to 3 posterior open bite as well as the anterior. This patient had recent bite changes within the last 2 years. You can see on the teeth that the teeth used to contact. So if I draw this right here, you can see there's wear on these teeth, and now the teeth don't touch. So the patient in the current position cannot grind their teeth, but previously they could have. So what this means is we used to have nice contacting teeth. And so what happened? So this patient is 55 years and over. So what sometimes happens is the muscle tone, the lip pressure, tongue pressure changes. And so sometimes this can cause an open bite. So let's go a little more deeper. So why does an open bite occur in the first place? Sometimes it's from a pacifier or thumb sucking, and that doesn't allow the teeth to erupt. Sometimes it's from tonsils and adenoids blocking the airway, so you become a mouth breather. That usually results in a narrow maxilla and mouth breathing. Then comes the tongue thrusting, and that makes it so the teeth can't come together. And in this case, it's actually going to be recent changes in muscle tone, and that's age-related. Sometimes this happens around the age of 50 or 60 or 70. If you had an accident or something where it caused your muscles in your mouth to change, then your teeth can actually change, and that's what we're seeing in this patient. So the treatments for this, sometimes for different open bites, are extraction or jaw surgery. In this case, Invisalign clear aligner treatment can definitely fix this. You've already seen my previous video on the anterior open bite. This one was 6 millimeters. That's done with Invisalign. Lateral open bites are caused very similarly because this one is a maxillary constriction issue, and that caused the open bite. And then when we dive a little deeper into this patient, it's going to be arch form. As you can see, the before and then the after. The arch form is different. We have a much more broader smile. We have a broader arch form, and therefore the teeth can line up together. So in my opinion, for this case, the open bite was created because the muscles lost tone, and therefore we had constriction, and the teeth no longer could touch anymore. And as we put the teeth back to where they used to be, now all the teeth come together again. Let's take a look at the digital simulation. On the left side is the before, the right side is the after. You can see how nice the treatment worked out. Let's take a look at where the teeth contact. You can see we have that complete open bite where we're only touching on the palatal cusp of the top teeth, and there's barely any contact. So this patient has trouble eating, can't really chew well. When we take a look at the lower arch, you can see how much wider the lower arch is at the final versus the initial, and same thing at the top. We're a little more constricted here in the premolar area, and we're a little bit wider. So what we did is we just did arch form coordination, where we made the arches the same size, and that's how they fit together. So that means is we expand. You can see right here the expansion in the premolar area to round it out, and on the bottom we actually did full expansion for the back teeth because we lost the expanded arch form and it's constricted. So we're doing more expansion on the bottom versus the top. And that's what's needed to get the teeth to look perfect. Let's do a quick treatment recap for this patient. We have a complete open bite on the left, right, and center. This was caused by constriction of both the upper and lower jaws. The treatment for this is to expand and widen to get the teeth back to where they used to be. You can see on the right maxillary photo how much nicer the expanded arch is. Then we went ahead and expanded the lower arch to fit with the upper. And that's how we close the open bite. And this patient has contact on all teeth. She's thrilled with it. It only took 12 months. It worked out extremely well. It actually worked out better than I thought it would. And she's extremely happy. Thank you guys for watching the complete open bite closure with Invisalign. Invisalign is my go-to for open bites. Invisalign can handle anterior open bites, lateral open bites, and in this case, complete open bites. If you have an open bite, Invisalign can probably take care of it. It's a lot better than extraction or jaw surgery. If you guys like this video, don't forget to like and subscribe. Don't forget to check out my other videos on Invisalign and other open bites, and I'll see you on the next one.